Welcome back to Soda City Live. October is long-term care planning month, but when is the right time to start having conversations with your family? Well, older adults and their adult children may oftentimes avoid discussing care options due to opposing views on the matter. In fact, Synergy Home Care found that in a survey, nearly 140 current clients and almost 40% of adult children surveyed felt a strain in their relationship with their aging loved ones throughout the elder care process. Joining us today is returning guest Synergy Home Care gerontologist, Dr. Macy Smith. Thank you so much for joining me.
Thank you, Sierra. Thank you for talking about it.
And it's always a pleasure to have you. So when is the right time to start having these discussions?
Now. So you don't have to wait until you become of a particular age to start having a conversation about long-term care planning, because what happens is you run into resistance with your older adult loved one and nothing gets resolved. And the last thing you want to do is guess about what they want. And the last thing they want to do is have you guess about what they want. And so as early as possible, you should begin the conversation.
And speaking of early as possible, because it doesn't necessarily even have to be for your parents. It can also be for yourself. So even the same advice applies to that.
Right. And the planning is not really for the person. It's really for the people that are left behind, the survivors. So you don't want sisters and brothers and loved ones bickering about what mom wants or what dad wants. Having that information spelled out is just a blessing to those who have to fulfill one's wishes.
That's amazing. It's amazing that you say that, because I don't think we even think about that. I'm not going to say an older adult now, but I'm an adult and I never thought that that's something or a conversation I would even need to have this soon, because we always feel like there's always going to be more time.
Yes.
Now you have some recommendations for us, but before we get into that, I want to talk about what should be on that list. What are the things that should be on that list of your planning?
And so when you think about your loved ones, in the event there's a chronic illness or an emergency situation to whereas they can no longer live in their home, thinking about what type of home care services they might need. That is a part of long-term care planning. Just different service, a variety of services that will assist a person to live longer term or longevity in a healthy manner, their well-being. So that includes in-home care, that includes out-of-home placement. And then when you're talking about that, you also have to bring into play advanced care directives. So we're talking about the healthcare power of attorney, the durable power of attorney, the live-in wills, the DNRs. It's a lot that goes into long-term care planning. So starting now will give people time to ensure they get it right.
Now, speaking of starting now, what resources? Now, I know Synergy Home Care may have some. What other resources are out there, especially when it comes to financing some of these?
Yeah, so I always recommend contacting an elder attorney. The elder attorney has information about Medicaid planning, Medicare planning, and any other long-term care planning options that many people don't even know exist or know to ask about. So the number one contact after visiting synergyhomecare.com would be an elder attorney in the area, because they specialize in long-term care planning for our older adult population.
Oh, wow. Thank you. Great information there, because those are things you don't think about.
You don't, not until it's time.
Right. Absolutely. Well, Dr. Macy Smith, she has a few recommendations that she wants to share with us. We're going to pull up that full screen. So tell us about the first one. You have, I believe,
being inclusive.
Yes.
So, you know, being inclusive is not about it is about we, it's about us. You want to be specific. You want to designate a specific time to discuss the planning process. You know, don't speak in generalities. You want to be specific. You want to be gentle. You don't want to force the topic. You don't want to rush the person into making decisions that are already tough for them. You want to be open-minded and accommodating. You want to listen to their concerns, their anxiety, and you don't want to strive for total control. You want to better understand what their angst are, and a lot of times, Sierra, bringing in a third party will help alleviate some of that.
Awesome. Well, thank you so much, Dr. Macy Smith, for joining us today and sharing these wonderful recommendations. Hopefully our viewers at home will be able to take a lot of these tips into consideration, especially when it comes to having those conversations and planning ahead.